Good morning and welcome to this public briefing of the Standing Committee on Social Development. My name is Shauna Morgan. I am the MLA for Yellowknife North, and today I'll be the acting chair of this Standing Committee. At this time, I'll ask members in attendance to introduce themselves. We can start from with a member in the room and then we have several members online.
Okay, thank you. I'm Julian Morse, MLA for Frame Lake in Yellowknife.
Okay, and members online, starting with Mr. McNeely. He's muted. You're muted.
Okay, there we go. Good morning. I'm the MLA for the Sawtoo. Danny McNeely is my name. Thank you. Good morning.
Next online, Ms. Reed.
Thank you, Madam Chair. Thank you for having me to your committee. My name is Kate Reed. I am the MLA for Great Slave here in Yellowknife.
Okay, Ms. Yakalaya. Can you try unmuting? Okay, well, we have Ms. Cheryl Yakalaya, the MLA for the Det'anchogh, and finally, Mr. Hawkins.
Good morning, everyone. My name is Robert Hawkins. I'm the MLA for Yellowknife Center. I'm not a member of the Standing Committee on Social Development, but this is a topic of interest to me, and I think a number of my constituents. So I wanted to be involved and follow along like the millions of subscribers we have on social media. So I think we're quite eager to hear what you have to say. Thank you.
Okay, thank you, members. So today, committee will hear from the Yellowknife Firefighters Association as well as Advanced Medical Solutions regarding paramedicine in the NWT. After both groups have provided their presentations, we will move to a question and answer session with all witnesses. But we will start by turning the floor over to the Yellowknife Firefighters Association. So please introduce yourself and then go ahead and proceed with your presentation.
Hi, good morning. I'm Christian Petrov, president of Yellowknife IFF Local 2890, also known as the Yellowknife Firefighters Association. So moving forward with the presentation here, I just got a quick presentation, and then obviously I will be available to answer any questions should you have them. I like to keep things short, brief, to the point, so we'll get right to it. Obviously, I think EMS regulation is long overdue. This is the second time I've gone through this process. I was part of a committee back in 2015, 2016, and when I thought this was actually all but said and done and going to move forward. So here we sit 10 years later. Still behind a lot of other jurisdictions, having the same conversation again. So hopefully we can move forward on this one. The EMS regulation, what benefits it would have, it would standardize patient care across the territories. And that's important. I'll get into that a little bit. The credentials, by having the regs, people's credentials would be uniform across the board. System integration, protections for both practitioners and for the public, as well as some accountability and fairness. So these are some key points that EMS regulation would bring to the Northwest Territories. All right, so for standardizing patient care, having uniform competencies, regulations sets mandatory baseline education and continuing education requirements, ensuring EMS can safely and effectively treat patients regardless of their jurisdiction. I think that's really important for the public to know exactly the level of care that they're getting across the territories, and it doesn't shift or change like fiefdoms as you move through municipalities or communities. Evidence-based protocols They would empower local medical directors to develop, enforce, and update life-saving clinical directives. For us in Yellowknife, when we thought regulation was happening in 2015, we looked at how we do our protocols. It was actually quite interesting that when I started in 2011, we had about 5 protocols that were created by the workers, so members on the floor, and definitely delivered a much lower level of care to the public with, at that time, no oversight. We didn't even have a medical director at that time. This would help correct that. We have since obviously have a medical director, and we adopted Alberta's protocols because they are constantly changing. Oh, apologies. They're constantly changing, and Alberta is much larger, and they were able to take all the evidence base, the studies that they do and take part of, and it's a board of doctors essentially that dictate what the protocols are going to be, what amendments to make, and to stay on the cutting edge. That would have been difficult for us to do, so regulations would set that standard and that tone. And then the scope of practice, it legally defines the medical procedures practitioners are permitted and qualified to perform, minimizing the risk of malpractice, as I stated earlier, and use examples. We really just didn't even have a scope of practice, and we dictated it ourselves, which is in 2026 kind of concerning that is something that could technically be on the table. We've internally corrected some of this stuff. However, it'd be nice to have this across the board and not have any of those shortcomings being available. Credentials, so credential portability should be no shocker to anybody that the Northwest Territories sometimes struggles attracting people. Having standardized regulations simplifies the process for paramedics to move from work across regions while maintaining verifiable qualifications. Sometimes people come up here for a short time, sometimes people come up here for a long time. Not having the credentials being portable does and has caused significant headaches for a number of my members. Not so much moving here, however, trying to move back out because there's no regulations, there's no standard. It starts getting into a really interesting process, which isn't always the most simple, and that might also scare people away from wanting to come up here even for a stint of 4 or 5 years if they can't easily transfer back out once they want to. So having credential portability would be an important factor. System integration, so system efficiency. Regulation allows governments and health authorities to monitor and manage ambulance response times, fleet utilization, interfacility transfer systems. Kind of gives them a seat at the table. Hospital coordination, it enforces regulations ensuring smooth triage and transfer of care upon arrival at the emergency department. Hospitals knowing exactly what the level of care that is being given by ambulances is important, and not this be like, well, we don't know what you guys actually, what your protocols are or what you guys do. And then if that changes from regions, so for Yellowknife, for example, if Det'anchogh ambulance comes into town, they're offering a different scope of practice, different level of service than potentially we are in Yellowknife. That causes some headaches for the hospital. And then emergency service coordination, this allows for a cohesive response to public health crisis, natural disasters, and large-scale events. So if you take something like the 2023 wildfire or other such things that are just going to be more and more frequent as we move forward into the future, having those other services join or us join them would mean that the continuity is the same. We're following the same protocols. We're following the same scope of practice. That just allows for some better cohesion, and it allows you to deploy your resources in areas that you need it and not have it be a change in level of care. It's also harder to basically command that at that higher structure if there's a variance in the scope of practice. Protections, so patients' rights and ethics, strict regulations on documentation and patient data privacy, consent rules for high-risk refusals, and strict ethical code. So if you have regulations, you can dictate that across the territory and it'd be the same. Advocacy for and resources. So formal recognition as a regulated healthcare profession can lead to better funding, clear labor rights, and improved mental health and safety standards for first responders. And then liability management. It provides clinicians with a clear legal framework regarding duty of care, informed consent, and documentation, reducing their vulnerability to civil litigation. My profession tends to be driven by either written in blood or through litigation. Regulation came to be in other jurisdictions for those very same reasons. We don't have to learn the hard way that the regulation actually protects all those that are in that profession. Accountability and fairness. So incident investigation, have a formal regulatory or licensing board allows for objective investigation of complaints or medical errors, holding negligent agencies or individuals accountable rather than relying on a inconsistent internal review. It might be strange that you're listening to a union representative saying those things, but at the same time, by having that board, any of the complaints can also be appealed, and you actually have a body that's there to hear you out. Because right now, it could just be a decision made by the employer, and there be no real appeals process, and not based on any sort of level of fact or anything else. So it's important for both, right? And it's important for the public to have that system, and it's important for the employees to also have that system to have a fair process on where we get to the bottom of medical errors or complaints, and they be treated fairly. All right, honestly, the most important part of this is that we have a seat at the table. So that's my ask to you guys, is that if we do move forward with this, that we have a seat at the table as the people on the ground, just like we did, honestly, in 2015 or 2016. So use the expertise that you have with people that are actually doing the job. This will ensure that all the concerns are appropriately addressed and all affected have a say in shaping the process, and no one gets left behind. I've heard some conversations both in chambers and outside of chambers and concerns about EMS regulation. I do think every single one of those things could be addressed. Just a similar process that we did in 2015, 2016, that nobody's actually being left out, nobody's being cut out. There is a path here. There's a lot of very knowledgeable people to make that happen. There is some nuance to this because you're going from not being regulated to being regulated. What does that process look? There's some questions about cost and who pays. There's questions about the education level and et cetera. The rest of the country has already gone through this, is caught up. There is a clear route here, and there's a route here where everybody's concerns gets addressed, in my opinion, quite appropriately and quite effectively. That kind of brings me to the end of the presentation, so just open it up to any questions or comments, I guess.
Okay, thank you for the presentation. Now we will hear from we will hear from Advanced Medical Solutions. Please proceed with your presentation. Okay, please proceed with your.
Thank you. My name's Kara Livy, and this is Brian Carrier. We're from Advanced Medical Solutions. I'll be doing the speaking this morning, and then both of us are available for questions. So good morning, Madam Chair and members of the committee. As I said, my name is Kara Livy, and I'm the president of Advanced Medical Solutions. I bring over 32 years of experience delivering healthcare in the Arctic across hospital, pre-hospital, transport, remote industrial, and community settings. I'm credentialed as a registered nurse, as a nurse practitioner, as a paramedic, and a flight nurse. I have a deep understanding of multidisciplinary teams from a lived experience and have a unique opportunity to share that experience in creative and collaborative ways. Advanced Medical Solutions is a healthcare provider with our headquarters based here in Yellowknife. We specialize in remote and emergency healthcare services all across the Arctic and northern provinces. We provide air ambulance services throughout the entire Northwest Territories. We provide ground ambulance services in Nunavut. We provide remote industrial and medical occupational health services across the Arctic. We have community paramedic services both in the Northwest Territories and all throughout all 25 communities in Nunavut. And we procure and sell medical equipment and supplies from our headquarters here in Yellowknife. AMS is the largest employer of pre-hospital practitioners in the Northwest Territories and Nunavut. We value and provide excellence in both the care we deliver and the services with which we're entrusted. We have multiple healthcare and business organization accreditations, much like the hospitals do, and we're very proud to boast that we are one of only 2 critical care air ambulance services to hold the very highly coveted CAMES accreditation in all of Canada, and we've had that accreditation for over 10 years now. We have worked over 30 years in collaboration and in partnership with the NTHSSA to help modernize paramedicine in the Arctic. And I appreciate the opportunity to contribute to this very important discussion. And as said earlier, we did have discussions in 2015 and 2016 as well, so we've been consulted multiple times. My message today: paramedic regulation in the Northwest Territories must be designed around one core reality. Paramedicine in the North is not a single profession. It is a full continuum of care, from community responders to critical care specialists. If regulation does not reflect that, it will create barriers instead of solutions. I'd like to talk a little bit today about the scope of the reality in the Northwest Territories. Across the Northwest Territories, in particular within our organization, paramedics spans a wide range of specialized scope. EMRs are community-level responders, often the only immediate emergency care available. Primary care practitioners, PCPs, are often act as frontline emergency and ground transport specialists. Acute care practitioners or advanced care practitioners provide advanced assessments and clinical decision making, and often with a higher level of autonomy. And then critical care paramedics provide emergent and ICU level air ambulance care for long-distance transports. These providers work across ambulances, aircraft, clinics, remote sites, and community settings. The delivery of care ranges from basic response to critical care medicine, and they are trained to operate without immediate physician support. A critical care paramedic on an air ambulance and an EMR in a small community do not require the same regulatory model. If we attempt to regulate them identically, we will overburden one end of the spectrum, the EMR, and we will constrain the other, the critical care paramedic. There are many benefits to regulation, no doubt. Regulation does provide real value. It provides public safety and confidence with clear standards, a complaints process, and accountability. It helps with professional recognition. It supports the evolution of paramedicine as a healthcare profession. It provides risk and liability clarity, particularly important in high acute environments, such as the air ambulance team, critical care transport, and multi-provider systems. It assists with system integration It supports expansion to community paramedicine, primary care augmentation, and chronic disease management. However, there are risks. One of the biggest risks is the concept that one-size-fits-all regulation. This is the most important risk, and if we head that direction, we will fail. EMRs require accessible, low-barrier entry. Critical care paramedics require highly specialized, flexible, and often nationally recognized credentialing. If one model is applied to both, we lose risking community responders and we lose risking critical care capacity. A second risk is workforce access and mobility. The North depends on nationally mobile clinicians and rapid onboarding. We do not have any paramedic training in the North other than the EMR training that our organization provides. Barriers such as new licensing layers, duplicate credentialing, and slow approvals will definitely impact both recruitment and emergency response capacity. A few years ago, with the evacuation of Yellowknife due to the wildlife fires, AMS stayed behind, and we provided care in the hospitals, we provided care in the communities, and we provided support shoulder to shoulder with the firefighters. We brought in a lot of practitioners to be able to do that. If we had barriers to bringing in those practitioners, we would not be able to provide that emergency response. A third potential issue is the financial burden. That's been one of the barriers that we've seen over the last 30 years. The Northwest Territories faces a fundamental structural change. There are not enough paramedics in the territory to sustain a traditional regulatory college model. Without scale that the other provinces have, cost per registrant increased significantly, and these fees are transferred to the practitioner, to the employers, and the health system. We have seen it in the other professions. High registration costs. We know that the nurses within CAN pay the highest fees across Canada. Reduced interest in northern practice and increased financial pressure on an already limited workforce. Regulation must not make it more expensive to work in the north than it does in the south. The fourth is risk to the critical care and air ambulance capacity. Critical care practitioners operate in a specialized environment with national recruitment requirements. We require alignment with aviation and critical care standards. If the Northwest Territories regulation is too rigid or not aligned externally, we risk losing access to these practitioners and undermining the air ambulance capabilities that they currently have. The fifth risk is the risk to innovation. The North has successfully developed nurse-paramedic integrated models, community-based care, flexible workforce approaches. We see that very much in the community paramedic programs in Nunavut. Rigid regulation risks reversing these gains that we've had over the last 5 years. We need to look at solutions that minimize cost and maximize fit. This is where the real opportunity exists. I think the principle of having the right size regulation for the North is an important one. We do not need to replicate Southern models. We do need to adapt them. There are many options. We can look at hybrid regulation modeling. We partner with existing regulatory or professional bodies. We can partner with Southern colleges and associations, obviously look at alignment with entry exams that like the copper exam that is fairly new, been one of the barriers in the past as to why regulation was difficult in the Northwest Territories and Nunavut, but now that we have an exam that 7 provinces are using, that's a great place to start. And also partner with national and regional nursing and health regulatory infrastructure. We have CAN right here in the Northwest Territories and Nunavut. How can we leverage that existing system? In this setting, GNWT would retain the registration and oversight authority, while the external body would be responsible for credential validation, standard alignment, and competency frameworks. The benefits we would avoid building a full regulatory college. We would reduce administrative overhead, leverage existing expertise, and maintain national alignment. We must incorporate tiered and blended regulation, so at different regulatory requirements for different levels. We must recognize the different levels that exist in the Northwest Territories. EMRs must have simplified registration with minimal barriers. PCPs and ACPs can have standard professional registration, and CCPs must have a special pathway that's aligned with national and aviation standards and their practice level. This protects entry at the community level, preserves advanced and critical care capability, and aligns regulation with actual risk. I also encourage for this committee to consider a tri-territorial regulatory framework. I believe this is the best long-term solution. A shared regulatory framework across the Yukon, Northwest Territories, and Nunavut. One of the key concepts would be to treat the North as one labor market, not three small systems. There would be shared credentialing systems, practice standards, and competency frameworks, and this would be recognized across all three territories. The benefits would be spreading the cost across the jurisdictions, increases the workforce pool, simplifies recruitment and deployment, and enables consistent northern practice standards. This aligns directly with how healthcare already exists and functions in the North. We have shared workforces, we have shared challenges, and we have shared reliance on external labor. As we transition, we need to make sure we do no harm. Before full regulation exists, there is the possibility to have title protection or a complaints and disciplinary mechanism while we work towards full licensing body and creating the infrastructure that we need to do that. The goal is not simply regulation. The goal is sustainable regulation. That means matching regulatory requirements to the scope of practice, minimizing the cost burden, preserving workforce access, leveraging existing Canadian infrastructure, and building a northern, not a southern model. Paramedicine in the Northwest Territories is broad, it's flexible, and it's essential to healthcare delivery across the communities. Regulation has the potential to strengthen this system, but only if it's designed thoughtfully. If we recognize the full scope of continuum of practice, avoid the one-size-fits-all model, and use hybrid and shared approaches, we can build a system that improves safety, maintains access, and supports innovation without creating new barriers. Thank you.
Now I'd like to ask the committee if they have any questions for the witnesses. Okay. Okay, Mel A. Morgan, do you have a question?
Yeah, thank you, Madam Chair, and thanks to all of you for taking the time to be with us here today. My first question is for AMS. Are you able to tell us, or perhaps send committee afterwards, if it's, you might not have it off the top of your head, but you broke down the different types of paramedics in the NWT. But if you have a breakdown of how many of each of those types of paramedics that you employ, just to get a sense of, you know, how many of each are within the scope of your operations, that would be helpful. And I'm also wondering if you can tell us which other provinces in Canada your paramedics are currently hold licenses with. I don't know if you know that information now, or if you could just commit to get back to us.
Sure.
Thanks, Madam Chair.
Okay, so the questions is for the advanced medical? Okay, yes, please go ahead.
I can give you a generalized answer, and then I can provide more detail later if you like. In terms of who is practicing in the Northwest Territories in Nunavut, we have all levels practicing. It does fluctuate based on the need, based on season, based on what's happening at remote sites, based on, we're doing some proactive staging of paramedics for fire response, those kinds of things, so it does fluctuate. But our air ambulance team is stable. Obviously, our ground ambulance team is stable, and so I can get you all those numbers. But we do have every level of practitioner practicing in the Northwest Territories that I've just listed. In terms of the jurisdictions where they're registered, so within our organization, we follow many accreditation standards. We have very high expectations for our employees, and we have, as our contracts are government-based, a majority of them are government-based, the requirements for our practitioners are listed in those contracts. So while there's not a regulatory body, there's a lot of stringent requirements that our paramedics have. Each and every one of our paramedics must be registered in a body within Canada. And we generally lean towards different associations. There are three provinces in Canada that don't use the copper exam as entry, and those provinces are a little bit more difficult to recruit from because their associations are different. The other associations that do use copper have a little bit more flexibility in how they register their practitioners, and we often use employ paramedics from those associations. We have worked with the associations since inception of Advanced Medical Solution. We have very, very good relationships with the associations, and it is our employer responsibility to ensure that if there's any practice issues, that we address them with the association that individual paramedic is registered with. We also have paramedics that are registered with multiple associations, so it can get quite complicated, which this would assist with.
Okay, thank you. MLA Morgan, do you have a follow-up question?
Yeah, thank you, Madam Chair. So, I mean, it's one thing to take an exam in a certain jurisdiction down south, or take your schooling, or to take the entry to practice exam, but it's another thing to hold a valid license with a regulatory body in the south. And so I've spoken with a number of regulatory bodies in the provinces that say that their licenses are not portable, meaning if someone is working outside that province, they are not working under a valid license. So for example, if someone is working up here and they were, registered or took their exam in Manitoba or Saskatchewan, what I've heard is that does not mean that they are operating up here with a Manitoba license or that they are operating with a Saskatchewan license. It doesn't travel with them. So can you tell me, does that mean that your paramedics are working here without a valid license if those colleges that they receive those licenses from don't recognize them if they're being used outside the province? Thank you, Madam Chair.
Thank you. Advance. Ms. Carla, the DB.
Thank you. That has not been our experience. Any time that we have had any issue with whether it's a complaint or a practice issue or a question or a concern, we have consulted with the colleges and the associations, and they have worked hand in hand with us. In the rare time that an investigation is required, we complete the investigation, we submit it to the association or the college, they review it, they look at the practice standards, and then they come up with a decision regarding that paramedic's practice. So we have worked hand in hand with them all the way through. So that has not been our experience, that any college or association has said, we will not take responsibility or assist with the evaluation of a practice of our paramedics in the Northwest Territories or Nunavut. So that is not the only way in which our paramedics practice. Our paramedics practice under clinical practice guidelines, and we have a medical director that ultimately reviews everything that they do. We have a quality assurance committee that reviews all of the practice that's provided by our paramedics, both in Northwest Territories and Nunavut, and so we internally review that as well against all the standards that come from associations, colleges, as well as the Canadian organizations.
If Yes, please.
If I could add to that. One thing to recognize is even in provinces that do have the colleges, the majority of quality assurance investigations and retraining, et cetera, are done by the employer. It goes to the college when that practice is so far outside of standards that it is in public interest in those things, and that's when we work with the colleges. But the majority of support, that's an interesting place for a plane to be, of those things are actually done by employers in order to meet those regulations and requirements. And then here, as was mentioned by Kara, often our contracts are specifying we have to do that, so we're held accountable to those standards. It's not we elect to, we must provide those services to those standards.
Okay, thank you. We'll go to MLA Morse. MLA Morse, do you have a question?
Yep. Thank you, Madam Chair. And I do want to note that I don't have a lot of background on this issue, so I think my questions are going to be kind of seeking clarification. So it's not exactly clear to me what's being asked for, and I think this question is more directed at Mr. Bitrolf in this case. But I guess my question to you is it important to you that we have a Made in the North regulatory scheme, or would some kind of hybrid model that involves using Southern certifications from the South be fine in your eyes? I guess that's kind of my first and most fundamental question is how do you see us most successfully rolling this out in a way that doesn't, overburden the system or create some of the risks that were mentioned in the AMS presentation? I just noted it is sometimes, I'll just leave it at that. That's my question. Thanks.
Okay, thank you, Mr. Bitrolf.
Close enough. I'll do my best to answer this. Paramedicine is somewhat of a young profession, and it's half of what I do fire as well, which is a much older one. And the funny thing about fire is that there is national standards, actually international ones, with us being in the States and that being easily recognized. So the portability of that is much easier. When it comes to paramedicine, there's still, and as we come out of these sort of fiefdom sort of situations, it's going to eventually, in my opinion, going to get closer to a national model, and hopefully that's where we're at. I think we probably don't have much of a choice other than to do some sort of hybrid model, if I'm being frank, in the sense that the schools are all in the South. People would go through those schools. Our requirements, since we thought this was happening in 2016, and to appease the medical director at that time and moving forward, is that you go to school in whatever jurisdiction you go in, they meet the requirements, the schools meet the requirements for that province, then they write one of those provincial tests, and then at a minimum of entry that they hold a license somewhere else. So that was the amendments that we made in 2016. It'd be hard pressed to see a different model that wouldn't be overly burdensome of cost to the Northwest Territories, just because unless you're going to create a northern school of paramedicine and then have a regulatory body and all those things, that gets really complicated. It is nice that they now have the copper that is recognized across 7 jurisdictions, so that has alleviated a lot of the pressures that way. And it does seem like that is probably someone's intent anyways, to kind of standardize the profession. I don't think we can reinvent the wheel up here. I don't think we have the resources. The reason we looked to Alberta for our protocols is for that exact sense, that it'd be overly burdensome to get a bunch of doctors in a room to create our protocols, to do studies, and the rest to stay current and deliver the best level of service to the people, which is ultimately what we're all here for. So I think the hybrid model is probably where you have to almost land, because just starting right from the start of education, you don't have something built here, and it'd be unlikely, in my opinion, that you'd be building something like that here. Hopefully that answers your question.
Okay, thank you. MLA Morris, do you have a follow-up question?
I mean, I'm fine with hearing from AMS on the same question as well,
Okay.
but I can ask a follow-up after.
Okay,
If they have something to say, I don't know if you have an answer to the question or.
Sure.
Please proceed.
Thank you. I completely agree. I think that the needs of the Northwest Territories and the residents here require paramedics and healthcare. I don't believe we would be able to home grow every paramedic that is required here, just like nurses, just like many of our professions. I think that we need to be able to pull from a pool across Canada. I think that there are really good solutions to the hybrid model. I do believe that the copper exam is foundational in that. We didn't have that until about 2020, so that's new across Canada and a really good step forward in terms of what a national registry would look like. I think that's great steps, but I think that working with either nursing regulatory bodies that already exist here in the Northwest Territories and Nunavut, or working with a college, or even both. And like I said, if you create a hybrid model that's tri-territorial, you will have the same expectations and regulatory requirements across all of the North. And the regulatory requirements can really be specified to the needs of the North, but the expertise in terms of the complaints committee, the practice committee, all those kinds of things, that would be held with others that already currently do that. And you know, when you look at the nursing, the way that nursing regulation has gone in the Northwest Territories, the nursing regulatory bodies were linked with Alberta regulatory bodies for a long time until they were able to mature into their own bodies. So it's a natural progression, I think.
Okay, please.
I would add, one of the reasons that it'd be very highly desirable to have certainly some made in the North solutions to this. I can take the EMR scope of practice, for example. In Alberta, the training is a whole lot longer, but it's actually less scope of practice than our EMRs have here. And one of the key things is they're not allowed to deal with delivering babies or women in labor. And if an EMR is a frontline practitioner in a Northwest Territories community, they can't really say, I'm not going to deal with you because I'm untrained to do that. You know, they are the only healthcare practitioners. So we would have to have some solutions that are fit to the communities that we practice in. And that's probably the easiest example that I could use. We need to make sure the training and the competencies for that are there because they're required to deliver that service in an emergency. So just cutting and pasting from another jurisdiction solely won't work. There needs to be a little bit of a balance.
Can I add a little bit to that too as well?
Yes.
So great example, and we also have that on the other end of the continuum, which is the critical care practitioners. Most provinces, most air ambulances within Canada have very short transport times. We have some of the longest transport times in Canada. Therefore, the level of practice and the skills and abilities that our critical care practitioners have will differ from other critical care practitioners. And so again, we need to align those with the scope of practice and what the North really needs.
Okay, thank you. Molly Morris, you have a...
I do, thank you. Yeah, I mean, this is just a comment, but I will say, I mean, I've had a few different professions approach me since I got into this role, and the one thing that stands out to me very, very quickly is just that anywhere there's provincial regulations of any of these professions, it would be so beneficial just to have national. Like I've had a few different professions, and the idea that you have to get different certification depending on where you move throughout the country, what a quagmire and a mess. And so I would just say all of this stuff would benefit from national regulations so that you can just work anywhere in the country. It's bad enough having to get different certifications to work if you decide to leave the country, but that's another matter and not for Canadian politicians to worry about. But to get to another point, I mean, I guess whenever we're talking about regulating anything, I think it's important to ask the question, well, what problem are we trying to solve? So I would just ask, what is the harm or risk of maintaining status quo in this context? So, and I would ask this to both presenters, what are we trying to fix, and what would be the harm if we just maintain how things are right now? And why are we looking to regulate this profession in a made in the NWT way. Thanks.
Okay. Thank you. Okay, who would?
I'll go first.
Okay, yes, Mr. Det'anchogh.
All right, to speak to that, I mean, I can speak personally in this jurisdiction, so in Yellowknife. The biggest change agent to our scope of practice, how we do things, was the idea that in 2016 we were going to move forward with regulation. Prior to that, it was the Wild West. So we've closed some of those gaps, not all of them, because unfortunately, if you don't have to do something, the tendency to do it if there's cost involved is to not do it. That tends to be the issue. So having the regulatory body would close some of those gaps. I mean, there's still a lot of outstanding questions. I wish my medical director was here because we're operating entirely under her license and her insurance, which is a little bit, that's a big risk for that individual to take on. We're very fortunate that we've found a medical director to do that. I can't say that's going to be the case in the future, and what does that mean moving forward? And then, I mean, right now, is there even anything saying that we have to have one? That's concerning to me, that we would be operating in this very unknown. Regulation dictates what you can and can't do and what the requirements are. Definitely changes things for insurance-wise and everything else. We're small, which the whole Northwest Territories is small. Litigation could very easily sink any one of these communities if it were to happen. It could even do quite the damage to Yellowknife, and it's the capital. We're not that big. We need protections. Regulation provides protections and provides cover for liability and risk for your medical director and for the practitioners. And then ultimately just improves our level of service to the public, which is hopefully what we're all here for, all being public servants in some way, shape, or form. So not having that is just because we've taken steps as Yellowknife to do things thinking that regulatory stuff was coming down the pipes. I'm not sure we would be sitting where we were if that wasn't a discussion in 2016. And I don't know what the future holds, and I can't speak for other jurisdictions. I got to feel that there was definitely some gaps in what they offer or do as well. There is a lot of more questions than answers on what those things look like what the insurance looks like, what the liability and risk looks like for every one of these places without regulation. I'm a big proponent on regulation for those reasons. Just because we've done certain things right, we haven't done everything right yet. So I think regulation would finish closing all those gaps.
Okay, advanced medical services.
Thank you. I think one can argue that it is the role and the responsibility of the government of the Northwest Territories to ensure that their residents are safe and that that they have oversight on what that looks like. Currently, it is downloaded from the government level to the practitioner level, to the organizations that actually provide the care, to the NTHSSA that's creating contracts. And so all of those responsibilities and regulations and requirements are downloaded to a contract, whether it's with the City of Yellowknife, the government, remote sites, those kinds of things. And there's no oversight. There's no ability to say you must have this or you must do that. And so this would allow, obviously, the government to fulfill their role and responsibility in ensuring all of their residents are safe when they're undergoing care from paramedics. I think that while many of us are here and are doing our very best, there are often, there can be gaps. And so this would allow for regulation to be able to identify those gaps and fill those gaps. That doesn't mean that the government of the North Smith Territories has to have all the answers, but they need to lead, they need to oversee it, and they can make choices. Do we want a hybrid model? Do we want to utilize another jurisdiction? What does that look like? But at least it's a formed opinion, it's a decision instead of choosing not to do anything.
Please go ahead, Dan.
One of the arguments I've heard is what's different and why now? Why is it required now? And I think we have to recognize that the profession of EMS has changed enormously, even in the last 10 years. We think of what we were doing in the field, and it probably didn't require as much regulation when it was very basic. When an EMR simply picked someone off the ground and moved them, now that frontline responder is providing life-saving medications. They are using devices that actually cut off blood flow and things like that at the very basic level. We have critical care paramedics that are doing things that are only seen in intensive care units. Very invasive, very complex things. And then when we work in community practice, we are working hand in hand with nurses and physicians providing complex care and diagnosing issues. So now the practice is much more complex. When you get more complex, the need for the public to have certainty and safety and consistency is much more critical. So when you look at terms of why now it's even more important, that would be my answer to that question as well.
Okay, thank you. Next, I have MLA McNeely. MLA McNeely, do you have a question? Okay, we'll go to MLA Yakalaya. MLA Yakalaya, do you have a question?
Yes, thank you for your presentation. It's been very informative. My colleague, I don't have all of the information too, but looking at what you talked about, you have a contract with the NWT currently. How for both the presenters? How long, what is the length of the contracts? Like is it 1 year, 2 years, 3-year contracts? Thank you. Currently.
Okay, okay, we'll go to AMS and YK Firefighters. Yeah, please
Thank
go
you.
ahead.
Each of the contracts have different lengths. So our air ambulance contract is the longest contract we have, and it's 10 years. And then our ground ambulance is 3 years, and then our community paramedic programs are renewing yearly. So and then we have contracts with remote mines and remote sites, and those are different as well. So each of the contracts has a different length of time.
Okay, thank you. MLA Akalaya, do you have a follow-up question?
Yes, I do. Thank you. And those contracts are based on like every time you go into the community, or is it you have a contract and they pay you out this much every yearly, like for 10 years, 3 years, and yearly the contract says you're going to get this much, and regardless of how many times you go into the community, is that what you would make? Thank you.
Yes, please go ahead.
Again, each one is different, and so for the air ambulance contract, that's a monthly fee, regardless of how many times we fly. And whereas a community paramedic contract is based on how many paramedics we have in each of the communities and exactly the number of days and hours that they work. So it's different depending on the contract as well.
Thank you. MLA McNeely, do you have a question?
Yes, thank you, Madam Chair. My question is to Advanced Medical Solutions. First of all, here, I want to thank both organizations for what I think was a very heartfelt presentation. And coming from a small community, you know, I see a lot of change and the high demand for frontline workers. Our today's environment is totally different compared to 30 years ago. So my question to Advanced Medical is, we hear repeatedly from the private sector and government themselves on the labor shortage. The vacancy rate here in the Health and Social Services Department in the Sahtu region, consisting of 5 communities, is 26.3% vacancy. Second to the Det'anchogh, they're at 27%. So realistically, you know, it's noted, and we know, and we agree with what Kara is saying, there's not enough practitioners. What is your organization doing to recruit more practitioners? Is there some kind of retention, recruitment plan that your organization is working on? If so, can you confirm? Thank you.
Okay, please, yeah, go ahead.
A great observation. Thank you for your question. It is really difficult to attract folks to the north to either move here or to be providing care on a rotational basis. There are lots of incentives to stay in their home provinces. We've seen significant increases in pay across all of the provinces in Canada. So definitely we work towards at least matching the pay that is provided in the south. But we do work really hard to distinguish what it is that we do in the north. I think well, AMS is very mission driven, and we work very much in community partnership. And I think for healthcare practitioners that are very mission driven, they're attracted to that. They're attracted to the north, they're attracted to the mission, the vision, the values that we have as an organization. And we really pour ourselves into our employees. We have the we're known for and have the reputation for having one of the best orientations and education model within pre-hospital across Canada. We have a fantastic orientation program. We have continuing education. We have a simulation center here in Yellowknife that doesn't exist anywhere else across the north, where we can bring in our practitioners, we can train our practitioners, we can simulate different medical environments and really learn in a very safe way. We provide all the certification and assistance in credentialing for the transferable credentials that was spoken about earlier, and we really try to ensure that we are an employee first company to make sure that we take out all the barriers so that our practitioners can just focus on patient care. Most healthcare practitioners don't want to deal with red tape and barriers. They want to just get in there and take care of people, and we do our very best to make sure that we provide that environment for them. But you're exactly right. We are currently competing for the same practitioners across Canada as everybody else is, and that can be a struggle.
Okay, go ahead.
One of the things too, in addressing the labor shortage, is what we're doing for training and education in the communities. So we currently have had the privilege of teaching probably the majority of emergency medical responders in the territory. We've taught everywhere from the Beaufort Delta to the South Slave, and many of the volunteer EMS services, our EMRs, we've trained. The more paramedic types of jobs that we have in the province, where did I just go? In the territory, actually is promoting labor mobility within the territory and encouraging people to build careers here. We've had some of our team members actually go to Yellowknife Fire Department over the years because they saw the training, they saw firefighters coming and training with us and went, we want to be part of that. Remember, I believe we have one of our good PCPs are on their way now over to work there. And we've had members of Yellowknife Fire Department come out to the communities and help train EMRs and introduce people to that paramedic profession. So there's been this sharing across. And the broader the paramedic profession is in the territory, the more likely we are to retain professionals where they can build a career and help grow medicine right across the territory. That's, and that's really what a large part of our goal is to develop that capacity within the communities and grow them. And we look at Det'anchogh EMS as one of our the best case studies of that. It started out with us as a private provider running that service, and now I get to come in and just train their grandchildren that are running their own service under their own leadership and mentorship. That's how we grow the profession in the territory, and regulation would help solidify that and help these practitioners have a framework to practice in. Thank you.
Yes, go ahead, please.
I mean, I work in the public sector, not the private sector, but I do feel I should speak to this. Recruitment and retention is an issue, and I did speak to the portability of credentials being part of that concern. The other part is when there's uncertainty, that becomes a concern for people who are potentially looking to seek employment up here. The lack of regulation and just having more questions than answers does scare potential people away. I'm heavy on the union side of things. I do go to conventions and the rest, and when we do talk to other individuals who are working paramedicine in the field, that is always their number one concern. Well, how does that work if you're not regulated? And then if the liability and risk is falling on the individual practitioner instead of a regulated profession, that's enough potentially to scare them away from even working up here or even considering working up here. I think we need to start having answers for these folks so that concern for them, because this is their career, and losing it after having all this effort put into starting your career basically because you hold all the liability and risk is very concerning for them. They would rather just work in another jurisdiction that doesn't have that risk factor or that what if question. I think it's long overdue that we start answering those, and regulation would do that.
Okay, thank you. I do have, I'm from Det'anchogh, and very proud of our EMR that work at the health center. I think they provide an excellent services, provide the services. So I am very, very encouraging and supporting them, and because it is a good career. The one that I know that, I've known them all my life, and I do feel comfortable, with some of the stuff that they do in the health centers, because I think they're, they very take their job serious. So that's why I'm very, I'm proud of them. But with that in mind, you did mention that with especially the advanced medical services, that you provide services in the small communities, in the outlying communities. So can you tell us what was the experience like? Because especially with a shortage of nurses, what's the experience like filling in for the nurses with a labor pool? My previous one of my colleagues did mention. So what was the experience like, especially in the small communities where they're used to seeing nurses, and all of a sudden there's no nurses, and it's the advanced medical services providing the health care?
You should be proud of your EMRs. They're phenomenal. So great for you to acknowledge them. And it's just a really good example that the EMRs that are practicing in your community are very different than EMRs down south. And so if we just took a cookie cutter regulation and tried to apply it up here, it would not work. It would actually take away some of the practice that your EMRs have. So that's where we just need to make sure we create a model that really reflects what the North needs. In terms of paramedics coming to communities, I think it's really important to recognize that paramedics don't replace nurses. Paramedics are not meant to replace nurses. Ideally, we should have paramedics in all communities. This, you know, in any community in the South, there are EMS services as well as nursing services. In our communities in the North, we do not have EMS services. We have community health nurses. They're very different focused practitioners, and their focus and their scope is different. And so we bring paramedics to the communities to help bring their scope of practice. There can be some shared skills and some overlap, but their focus is very different. And actually, when you look at one of the benefits that we have is working with the air ambulance team, we have flight nurses and flight paramedics. And when you go back and you look over history and time about teams in pre-hospital, the best team is a nurse paramedic team. There's been lots of different team dynamic research. So 2 paramedics, 2 nurses, a paramedic and an RT, a nurse and an RT. And what the research shows and what our practice has shown is that the nurse paramedic model is actually the very best model because they're coming with a different set of skill sets and a different focus. Nurses are focusing on health promotion, disease prevention, primary care, those kinds of things. Paramedics are coming with experience around dealing outside of a hospital environment, dealing in a chaotic environment, bringing calm to chaos, and dealing with situations where you know you're not going to have a physician handy. And so when you take those skill sets and you bring them together, it's a fantastic duo. And each one learns from each other, and each one approaches a situation slightly differently, but collectively, that's the highest level of care that we can actually provide. So when we bring paramedics to the communities, we're really trying to bring that paramedic focus. Absolutely, when there's no nurses, we've had that before in Nunavut, where they were going to close the communities, and instead we had paramedics at the community health center. Most people in the community are just grateful that there's somebody there and that the community health center is not closed, and that they're able to get the care that they need. We've not had any negative experiences where community members have not wanted to see our paramedics. They actually get to know them really well, and they become community members and have good relationships with them.
I would think, though, it does mention why regulation would be helpful in this practice, I think, because one of the challenges, we're both nurses and paramedics, so we see it from both sides. And understanding what your fellow practitioners' scope of practice is, what their regulations are, and how they fit into the healthcare system makes it easier for nurses to understand. And you probably find that when you ask nurses, how do they feel about paramedics? I'm not quite sure how we relate, how we work together, what each does. And that's because they don't necessarily have those regulations which to fall back on, whereas nurses do. They understand where they are in the world, how they relate to other professions, what they can delegate, what they cannot delegate. All of those things, those are very real questions that my nursing colleagues would have. So if we have regulation, then that enables those professions to work seamlessly. And right now they negotiate it well, they do work together well, but it'd be a lot more comfortable for everyone to have that certainty. And then we can make use of each practitioner in their correct role, in the right way, and complementary, instead of the way it is now where they have to negotiate that relationship. And then everybody's also protected by legislation, so the nurse does not feel that they're left in a spot where they're unprotected with another practitioner. And so I think that kind of, those things go hand in hand. While they do work together well, giving them that certainty would really help them work together well.
Thank you. I do have another, I have Mr. Hawkins, MLA Hawkins. Do you have a question?
I do, Madam Chair. Appreciate it. One of the realities of being, I think, 6th on the list is every time I draft my question for curiosity, everyone touches just a little bit of the same question, but not quite. So I apologize for that. I mean, again, it's not a criticism. It's just a reality of being down in the pecking order. First, I just want to make a comment because I think largely people tend to, and this is not meant to be tough on you guys, please don't think it that way, but we tend to think of paramedics or not think of paramedics in the system of healthcare because immediately we're always drawn to the primary healthcare. And we say, oh, healthcare, well, you mean doctors and nurses. And that's not a criticism. It's just sort of like what we naturally, through the ebbs and flows of observations, but until we need it, then we realize what a paramedic, what a critical service they provide by actually being the first responder to a situation, stabilizing care and control, bringing a person to an operational center, whether it's a healthcare center or any other types of places. And I mean that critical role of is so important to make sure someone is taken from one scene to the next so they could get that next level of care. So I mean, I don't think we do enough to promote how important or how critical it is in the chain of events. I mean, if you can't walk in on your own, you need paramedics, and that sometimes gets forgotten. And I want to say I try never to forget that, but I think sometimes it gets glazed over by the primary care service. So, Madam Chair, my first question is really about some of the risks, and because the ladder of care starts with paramedics, and that's sort of how I view it. And I think it can't be stated enough that there's a lot of risks to the public, including paramedics, without independent regulatory process. So could we sort of just dive deeper into, without regulations, how do we protect the public and the clients if we fail to meet the regulatory competency process? In other words, have one. And where do patients turn if challenges there's a problem with these types of challenges during care, and where do paramedics turn when there's problems? Thank you.
Okay.
So it's both on both sides protection. Thank you.
We'll go to Advanced Medical Solution first.
Sure. Thank you. Thanks for the question. Great comments, and thank you. There are risks. The risks are downloaded. So they're downloaded to the organizations that are contracting their paramedic services, and they're downloaded to the employer who are responsible both for the level of service and care that's provided, and they're downloaded to the other colleges and associations that the paramedic is registered with. And so, to your point, we would be following all of those rules and regulations instead of the legislation and the registration that would occur in the Northwest Territories. So all of that is downloaded, and it is the responsibility of those that are contracting the service, the employers, and the paramedics themselves to ensure that we're following those rules and regulations, and there's not oversight of that at the moment from the Northwest Territories government level.
Okay.
Oh, you're very limited time. I can.
Okay, yeah. Yellowknife Firefighters?
I'll just almost echo what my colleague over here has just said. Yeah, it's downloaded to the employer. I do also think there's probably just been a lack of legal challenge to actually firmly answer that question on what would actually occur. And my personal prediction is, as I stated earlier, you are potentially one litigation away from some very massive financial burdens on those communities or cities or regions that would have some very massive impact. I think in part because we're small, just that statistical pool, we just haven't hit it yet. If it happens, though, I mean, it'd be probably not very good. We can and should learn from other jurisdictions. Regulation didn't just happen because someone decided they wanted to do regulation. It happened based off of lawsuits. And we don't need to learn that the hard way, I don't think.
Thank you. Mr. Carrier,
I'll make it
give you the
very quick.
last question.
I do want to make it
answer.
clear that currently in the space, the way contracts are set up, and in both cases of our organizations, there is quality assurance process. There is investigations done into any mishaps or near misses very rigorously, and they are reported, in our case, to NTHSSA or whoever does hold our various contracts, and that does include retraining, potential discipline and things. So they are being done. It's not the public is not unprotected, but it's being, as said, downloaded. So the processes are being done and done well. And even this, like I've been asked to go into different communities and help retrain and re-educate providers. So I know that the smaller communities are also doing this to different degrees. We just want to all be doing it the same and be making sure it's consistent. So it's not that the world is unsafe right now, but we can make it safer and more consistent. So that's the message.
Okay, thank you. So on behalf of the committee, I would like to thank the witnesses for
Oh,
appearing.
Madam
before
Chair,
us.
can I ask one more quick question?
Okay, just one more questions and then we're going to be wrapping up.
Yeah, okay, thank you. I'll be brief. And yes, the earlier comment was about protection on both sides as well, just to be clear. The next one is just to reaffirm, are you seeing without the alignment of regulations, are you finding that there's like a standoffish approach, even looking at wanting to work in the Northwest Territories? In other words, knowing that it could be considered the Wild West, lack of regulations, that people are saying there's no way I'd move to the Northwest Territories because I don't feel that the standards are meeting their professional competencies, and feeling safe that the regulatory environment is there to protect them as well. So in other words, are we losing people who would normally be interested in working here in the Northwest Territories? Thank you.
Okay.
I just tried to make it as quick as possible.
Yes, Mr. Hawkins. Okay, Yellowknife Firefighters, please go ahead.
To make this quick, the answer is yes, you're scaring people away from applying. You're also scaring people away from staying, as a lot of people start their career and then they kind of unearth the scope of everything, and they aren't willing to take on that risk or not have those stabilizing questions answered. So the short answer, yes, you are potentially affecting your labor pool by not having those answers.
Okay, Advanced Medical Services, please. Agreed.
For sure. It does create a lot of questions. It creates some uncertainty. I don't have any data that says exactly how many candidates we've lost because of it, but it is, again, downloaded to our organization to be able to explain to paramedics that are asking those questions around regulation legislation about why it's different, how does it work, and how are they going to be safe.
Okay. Thank you. So I would like to say thank you to Yellowknife Firefighters and Advanced Medical Solutions appearing before us, providing us this important information about paramedics in the NWT. Thank you. Thank you. Yeah. Okay.